afternoon. I'm Lieutenant Briscoe. I'm with the Columbia Medical Recruiting Station, and today we're having our annual AMEDD Symposium. You guys should have already listened to the videos that we placed on our newest station, YouTube, and today we have our panelists. We have Lieutenant Colonel Regina Thorpe. She's a doctor, nurse practitioner. We have Major Helton. He is the Chief of Physical Therapy here at Moncrief. We have Colonel Warren Stewart. He is the Moncrief Hospital Commander and Doctor of Nurse Practitioner. And then we have Lieutenant Colonel Harris Abbasi. He is Moncrief's optometrist. We also have on Zoom, we have Major Katie Newmeyer. She works with the brigade, and she's also a pediatrician. So without further ado, we're going to go ahead and start asking some questions. So first question we have here is for Major Newmeyer. Can you hear me, Major Newmeyer?
Yes, loud and clear.
Perfect. So the first question is for you. So far we allowed our students to review some of our videos that we had, and they submitted questions to us on behalf of your videos. So one of the questions that we have are, what made you choose DO over MD school?
That's a great question. So I get it often, DO versus MD. So for me, I knew when I was applying to med school, I was only going to be applying to DO schools. My primary care doctor throughout all my childhood and adolescence was a DO, so that's what I was familiar with. And then when I went on a pre-med trip during high school, just to go check out different medical schools and different fields of medicine and get a feel for things, we visited a DO school, and their philosophy of addressing the patient as a whole person and not just their pathology really resonated with me. And that's ultimately my choice to go DO versus MD. But I think really any doctor nowadays approaches their patients with that philosophy as a human and not just a diagnosis if they're a good doctor. So I don't think that necessarily changes where you go to school at. But at the time, that's what resonated for me.
Amazing. That's great. Okay. Another question that I have for you is, do you owe any extra time for the fellowship that you took?
Yes. So for our standard HPSP or Health Professions Scholarship for Med School, you do the 4-year option. You typically owe 4 years after your residency. For me, since I did attend Peds Critical Care Fellowship, that was 3 years at a civilian institution, and the Army paid me while I was there. That added 3 years to my obligation. So I owed a total of 7 years after all of my training. But that varies depending on the specialty in which you pursue fellowship. For the fellowships that the Army has in-house and they offer, for example, they have neonatology or NICU fellowships. And I have friends who did those, they didn't incur further payback. But if you attend a civilian fellowship, you do.
Okay. The next question that we got was, did you have a choice in your duty assignment?
Great question. So choice may be the wrong word. But in general, as medical officers, I feel like you have more say in where you end up. So at the end of the day, ultimately, the Army's needs come first. And where they needed PICU docs, that's the options that were presented to me. And so you get to explain why your family or your career progressed somewhere better. But ultimately, it comes down to where the Army needs that specialty.
Professional reading development will be held at this.
Okay, so you said ultimately, you can finish that last part. I apologize about that.
Yeah, sorry, the sound sounded like it got a little messed up, but ultimately the Army's needs come first. You do get to plead your case for why you want to be somewhere, that hopefully you end up where you want, but ultimately the Army will find a spot where they need that specialty the most.
Okay. Another student wanted to know, what is the match process like in the Army?
Great question. I answer that a lot. So the residency match process in the Army is very similar to the civilian match. There's kind of two big differences. And the first is at STAR scale. So Army residencies are only for Army students. So those that have an HPSP scholarship or those who attended USIS under the Army. So there's less positions per specialty, but that's because there's less applicants. So in general, it's proportionally competitive. Things that are competitive in the civilian world are also competitive in the Army, whereas things that are less competitive are less competitive in both. And then the second big difference is you find out your results earlier. So in December as opposed to March, which in the grand scheme of things, 3 to 4 months doesn't make a huge difference. But if you have a significant other who has a job or is a civilian medical student who's trying to match with you, it gives you some flexibility for that and the option to plan your move a little earlier. So those are the two big differences, but otherwise it's very similar. It's an online portal where you submit your license exam scores, your GPA, your letters of recommendation, and that gets then sent to the program directors for review.
Okay. And I think some people probably didn't get that this question in your interview, but what does your daily schedule look like as a physician?
Yeah, so for me as a peds critical care doc, it varies week to week depending whether I'm on clinical service. So the day-to-day would vary a little bit based on your specialty. But for me, when I'm on clinical service, there are long days and there are long weeks. So usually starting at 6 or 7 in the morning, get to the hospital, I would do my own pre-rounding before I'd eventually round with the medical students and the residents after morning report where they had some sort of case report or lecture they received. We would round and examine the patients for a few hours depending on how many patients we had, and then spend the afternoon discharging patients or admitting patients, making changes to our plans for the patients that we did have, and doing some teaching. And then overnight, I would probably be on call from home in the Army, just since our PICUs tend to be a little smaller, so they don't necessarily need an in-house attending. But if there was really sick patients, I would stay in-house to support them. And then, so that would usually be for 7 days or a week long. And then the following week would be a little bit lighter in terms of the timing. And I'd have time to work on my research or work on further teaching obligations. That's what I really like. So I do a lot of simulation with the residents and students or leadership opportunities if that was the track I was following.
That's perfect. And I just want to put a disclaimer out there. Major Neumeyer, if the call does hang up, please try to call back in and we will re-add you. But let's answer this last question. And the last question was, how did your family feel about you applying for HPSP?
Oh, great. So initially,
Okay, well, the call did go out, but we will have her call back in. In the meantime, we'll make sure we move along to our panelists that we have right now. And first up is Colonel Stewart. So the first question is, can you change specialties while serving in the Army as a nurse? For example, critical care nurse to a nurse practitioner?
Yeah, absolutely. First of all, can you hear me?
Yes.
Yeah, so that's a great question. So yeah, so typically you'll come in, if you're coming as right off the street, you'll come in as a generalist nurse, so we call that a 6-6 hotel, and it's a medical surgical nurse, and then you get the opportunity to specialize. Typically people, when they specialize, will stay in that specialty for the majority of their career, but you have the opportunity to go to grad school and get your doctorate in as a nurse anesthetist, as a nurse practitioner, as a midwife, several other opportunities. Or you could be a ER nurse and decide that you wanted to go public health, and you could do that. But for the most part, you'll specialize, you'll stay there. But when it comes to advanced degrees, that's where you really get the opportunity to completely change sort of what you're doing. I think that's Major Thorpe or Colonel Thorpe is a perfect example of that. She was a nurse that went to get her doctorate, and now she's a nurse practitioner.
Can you please add Major Neumeyer back into the call? She's calling in. Okay. So the next question I have is, how long did it take for you to be placed in a leadership position?
Oh, that's a great question. So I would tell you, as a nurse, you're placed in a leadership position almost immediately. It was quite honestly about 4 months out of preceptorship at Walter Reed as a second lieutenant that I became the charge nurse, working a pretty busy ward on a night shift as either the only RN or of a couple RNs. So you're in leadership positions right away. I will say we've sort of changed how we do that a little bit. We provide all our new nurses a residency program, for lack of a better term. So your first 6 months to a year, you're actually in a pretty structured learning environment where we protect you from deployments. We just want you to become a phenomenal bedside nurse. But those opportunities for leadership happen extremely fast. And I've had opportunity to command multiple units, been department chiefs of multiple units, both in the deployed setting and here, you know, in stateside. So leadership will not be a problem. You will almost be forced to be a leader, even if you're not comfortable with it. But we will help you become comfortable very quickly.
And because you had a few things to say about deployment, somebody wanted to know, how often do you deploy? Are you in a war zone? And while you've been serving in the Army, how often are you deploying?
Sure. So I've been in the Army a really long time, so that's sort of a loaded question. But typically, when we were in the war on terror, which is now for the most part over, although there's still nurses in harm's way in certain areas, contributing to the fight against terrorism. But for the most part, you deploy. My deployments have been year-long deployments, but typically the deployments are 9 months or 6 months. I will say there's not a shortage of opportunities to deploy right now. They may not be to a combat zone, but we've got significant numbers. Matter of fact, I would say the Army is more deployed right now than it's been in years because we're in Europe, we're in the Pacific, we're in Africa. So they may not be combat zones, but they're definitely away from home. But there are opportunities to do nursing care or any of the care that we provide here in Army medicine in an environment that's very rewarding and it's actually vital to our strategic influence across the globe. So typically 9 months, I would say. If you're really thinking you're going to deployment, we think 9 months. That happens every few years. Some go more than others, depending on your specialty. So if you're a critical care nurse or a nurse anesthetist, if you're a surgeon, those sort of things, that's a skill we need in a forward area. You could potentially deploy more often, but I don't think it's overbearing. And most of us like our deployments, and actually the reason we stay in is for those opportunities.
Okay. So the next question is, how is quality of life while you're serving as an Army nurse?
I think it's great. I think the two things. I think being a nurse in the Army is special because of the population we get to take care of. It's extremely rewarding, both the soldiers that we take care of, but their family members and those retirees that have given everything to our nation. I get to do that every single day, and I think that's one of the most rewarding things. So the quality right there is everything. That's my why. But also the Army has afforded me opportunities to live in Santa Monica, California, Boston, Massachusetts, Huntsville, Alabama, which, believe it or not, is one of the best places I've ever lived. And so it's just great opportunities to see the world and make an impact on others.
Okay. So a lot of people are concerned about like the family and military work balance. So somebody said, can you say that you have a regular life and normal family relationship?
I mean, I can definitely say that. Can I say that everybody in the Army has it easy and families all get along? No, but we're just a reflection of society. But for me personally, it's been a great opportunity for my family. My daughter, who is now married and doesn't obviously live with us anymore, but lives up by Fort Bragg, she enjoyed her opportunities to move multiple times and be all over the country and experience a lot of culture, and that's what's made her a great history teacher. She teaches history now, but that experience across the nation and understanding other areas and climates and cultures has really made an impact on her life. My wife loves it. She would continue to serve probably longer than I want to. She loves this opportunity to meet new friends and see different places every several years. But it's not for everybody, and it's not easy. Our spouses and our children definitely, I think, sacrifice more than we do. We always get to go to the place typically of our choosing, and we immediately make friends because at work we learn very quickly in the Army to bond and build teams. Our spouses and our children have to work a little bit harder because that's not necessarily given to them, but these communities are good at absorbing that, and they become very resilient very quickly. But there's others in this room that have bigger families than me that could probably speak to it and better.
Okay. The next question is, I think it's because I saw that you were the hospital commander.
Sure.
Somebody asked, how would you rate your career advancement? Like, how fast did you get where you are, or how do you describe that?
Ooh, I self-actuated a long time ago. I've had more opportunities than I think you could ever expect in any career, let alone in the military. But the opportunities to attend Harvard, to get my doctorate degree, to do a RAND fellowship, to command multiple organizations, to deploy forward and save lives on very complex battlefields and very complex situations. I couldn't ask for anything more, and I don't think as a brand new second lieutenant, brand new RN, graduating from nursing school, I ever would have thought I'd have the opportunities that I've had now, and I don't think I should even have expected it. So I can't say anything more. I think there's others in this room that feel the same way. Haven't been in it quite as long as me, so I haven't gotten to where I'm at, but it happens very quickly. It's very predictable too, and so you sort of can plan out your career. I would say the Army is getting more aggressive in promoting people faster, and rewarding and recognizing that talent earlier. And so that's actually there's a potential I could have got promoted earlier had I been in the system that we're currently in, but I think it works very well. Okay.
Another question is, do you take pride in what you do as an Army nurse? Does it give you purpose?
Oh, absolutely. So my purpose is right here on my wrist. Jonathan Felnico, he was an 18-year-old combat engineer that was hit by an IED, a bomb in Iraq, and I happened to be the first responder and provided care to him in the back of an ambulance all the way to our aid station. Well, he ended up unfortunately passing away. But I learned from that day, what we do is so important. Interestingly enough, his father showed up. His father was a sergeant major in our division and showed up right after he was killed, and I never expected to meet the father of a soldier that was killed there in Iraq. But it gives me purpose every single day to know that I have to get better. I have to make sure my soldiers are better every day and prepared to save lives on the battlefield. So I love being an Army nurse. Florence Nightingale was a battlefield nurse. So our profession stems from the battlefield, and I take great pride in that.
And my last question for you is, what is the difference in the patient population between the Army and in the civilian world?
That's a great question. I'll tell you, that's a little bit of a thing that we struggle with. Our patient population, by and large, is healthier than the civilian population for obvious reasons. Number one, we're very selective of who we let in, and we're much more active, and there's a lot of resources that are given to the soldiers and their family members to keep them healthy. And so that, I would say we're healthier in general, but we also take care of patients from, neonatal all the way through extreme geriatric. And so we still see the wide range of complex patients you'll see, just not the volume, but there are opportunities the Army provides us to go work in those places that see those patients, so we have the opportunity to be exposed to them. We have surgeons currently right now working in several medical centers, trauma centers across the country with entire teams with ICU nurses, anesthesia providers, you name it, combat medics that are out there right now working at some of the major trauma centers because we don't see enough trauma here, which is good, but we need that in order to stay relevant and ready for the next war.
Well, thank you so much for your answers. We're going to move to Lieutenant Colonel Abbasi. So my first question for you is, what area of optometry do you enjoy most?
I'm a general optometrist, so I love seeing patients of all different types. Particularly, I like disease. I think being an optometrist, being forward deployed a lot of times, seeing trauma, seeing disease is particularly rewarding for myself. But regular family practice optometry is really the main thing that we do.
Okay. What resources did you have that helped you to become successful? We have some people that are aspiring to be optometrists too. They're trying to follow your leads there.
What resources? I mean, in terms of schooling for undergrad, I was a recipient of the ROTC scholarship, HPSP, which is a great program as well. which will pay for tuition, as well as give you a stipend for medical school, for dental school, optometry, I think psychology, a couple other departments as well. So, I mean, just getting off the bat right there, they're going to support you, as well as they'll pay for your licensure, your malpractice. That's not something you have to worry about in the civilian or military world. Yeah.
What reservations did you have towards taking the HPSP scholarship, if any?
For myself, I always wanted to be a military officer, so I didn't have too much reservation. I do know a lot of folks, you know, if they've never been exposed to the military, it can be kind of daunting at times. The Army is it's a cross-section of America. We have folks from every single religion, every single background. You can dream it, and that's what makes this organization great. So if you're interested in it, I would tell you, hey, take a look, explore your options, reach out to folks who are in uniform. We're absolutely adamant about talking to folks and giving you our experiences to make sure you can make the best decision, what's best for you.
Somebody also wanted to know, how long did it take you to reach Lieutenant Colonel, and what did you do to earn your rank?
Yeah. Let's see. So I've been active duty for about 15 years. As an optometrist, you're commissioned as a captain, and generally you'll have promotions every 5 to 6 years. And it's based not on what you do, but on your potential to serve at the next rank. So number one, you have to be great at your primary job, which is, in my case, being an optometrist, taking care of patients. And then as you progress through the ranks, you'll have opportunities to lead organizations outside of optometry, perhaps schooling, and then kind of taking harder jobs, kind of outside your field as well, definitely help, and opportunities that come your way to kind of distinguish yourself.
Okay. Okay. Do you have a lot of free time outside of work, and what does a typical work day look like for you? Yeah,
that's a good question. It's generally in garrison when you're not deployed. You know, it's I don't want to say a 9-to-5 job, but you'll have PT in the morning. You'll come in and start seeing patients around 7:30 till around 16:30, and depending on exactly what you're doing, you'll have meetings, things like that. What was the second part of the question?
Do you have a lot of free time?
Free time, yeah. So generally, you know, we're home by 16:30, 1700.
5 o'clock.
Yeah, so yeah, sorry, 5 o'clock. And so the Army does encourage you to have a home life and a family life as well. We have a lot of programs. We have MWR, Military Welfare, Family and Morale and Welfare, yeah. And so they'll have programs for families. There's like, just on this post itself, we have several lakes, cabins, you can rent boats. There's travel opportunities. I think you were trying to go on a fishing trip at one point off the coast of Charleston. So there are tremendous opportunities, not here, but overseas as well. We have hotels in Hawaii. So the military, it asks a lot of you, but there's a lot of programs as well for yourself and your family so when you have your downtime to enjoy it.
My last question is, you mentioned, aside from optometry and clinical practice, that you also did had some administrative opportunities. How are you able to switch?
That's a great question. The Army, again, you join the Army and you come in as in your specialty, but there's a lot of opportunities that will come your way. Particularly for me, there's long-term health education training, which allows you to go towards for a further graduate degree. One of them is the Army Baylor program, which teaches you about healthcare administration. But the Army can also send you to schools of your choice for master's in business. I think there's a bunch of other programs as well to help you kind of further your career.
Okay. Thank you so much for your time. I'm going to move to next. So, in your interview, you spoke about how you were able to go through school, you didn't have any educational debt at all. It was very conducive to your family. And I think that spoke to a lot of people. One of the questions that I have, that one of the students had was, they want to know, how is it like serving as a female in the Army? I think that's one of the biggest questions that we get a lot of the time. And between you and Major Newmeyer, I'll let her speak on that after.
Sure. And I think it's a valid question. You always kind of hear these horror stories, but I think as a whole, my experience has been amazing. I think growing up through the military, I actually hit 17 years in about two days. That's going to be 17 years in the military. I have not felt any different. It's always a balancing act as a mother, but I think that it's completely doable. And I think Colonel Stewart had touched upon it, but having that family aspect and having my kids see the experiences that they've had has just been an amazing thing, and I wouldn't trade it for the world.
Okay. And when I come back, I'm going to also ask you the same question, Major Newmeyer, after I get through. Okay. So, my next question for you is, this was actually pretty funny. Somebody asked, life as a nurse on the civilian side is very hectic. How does the Army balance this?
I think it's a constant balance for any nursing profession, whether on the civilian side or the military side. It is going to have that degree of hecticness, but also predictability. And I think that, at least on the military side, you know that it's going to be predictable. You know that you'll have a job. Where sometimes on the civilian side, there's always a question, is that job going to continue in the future? But I know that every month I will get a steady paycheck and have that degree of predictability. So it's nice to have that.
Okay.
And I would just add, the other thing that's nice about it, there's a degree of predictability when you're going to get your raise and when you're going to get promoted and when you're going to change. So I think that's important. You don't get that anywhere else in nursing, where Regina knows every couple of years she's going to get a for sure raise. I can tell exactly how much it's going to be, other than it's going to get higher because of inflation. And then she also knows that this many years I'm going to have my opportunity for the next promotion. And that's not typical other places.
Absolutely.
Okay. So my next question for you is, if you could do one thing differently in your career, what would you do? If any?
I don't think any, because I think of all the decisions, whether good or bad, still led me to this position. I mean, I'm sitting at this table where we are right now. And so in that respect, I wouldn't change anything. I think the decisions you make, sometimes you're like, oh, should I have done that? But lead you to where you are currently, and I have no regrets, absolutely.
The last question I have is, how long after you joined were you able to go DNP, or Doctor of Nurse Practitioner?
Let's see, I think I was about 13 years in that I applied for my DNP. And then it's a process, so it's not, you immediately apply for your DNP and then you get it the next year. There's a little bit of training you have to go through. So I applied in, actually no, I applied in 2016 and then went to school in 2017. So.
Oh, wow. Okay. Okay. Well, thank you. Thank you. My next person will be Major Helton. So this is a military person, I know, because they said H2F, and that's health to fitness. But they want to know what, if you have any idea, or what caused the Army to initiate an interest in the health to fitness?
Sure. So another nicely loaded question. So I've been in a minute. I was a medic from 2002, 2006, and then came in a couple years later as a physical therapist. But I had the opportunity to kind of see a bit of the transformation, because early on in my career, it was all the focus was on treatment after the injury, getting better with treatment. At least from my own experience with MSK and a little bit with the medic side. But say around 2008-9. That's when we started trying to plug the physical therapist into the brigades, trying to nest us into the unit. One, to establish rapport. Believe it or not, some folks tend to stay away from the clinic because they want to continue, in the path they're on. They don't want to be slowed down. And then, of course, they eventually reach that threshold where they have no choice but to get treated. And we were good at it, but, again, up until that point, they were coming to us. So we decided we needed to go to them. And, that was kind of the start of it. And since then, we have, introduced kind of a multidisciplinary approach to really ensure that we're taking care of the soldiers on the front end and ensuring that they're ready to fight at any point in time. I think that was the kind of the biggest piece there as far as the H2F initiative.
Okay. So the next question a student had is, how is preventative medicine or preventative techniques integrated into basic training and throughout the soldier's career? A lot of people get hurt, I see.
Yeah, that's a great question, and one that we're still kind of seeking the answer for, and have strategies in place and continue to build those. So again, I'll rewind a bit. I came in and I was you talk about going into a leadership position. When does that happen? It varies from person to person, from occupation to occupation. But in my case, I had the opportunity to be a staff PT for about a year. And then I took over a clinic, did that for 6-8 months, and then had the opportunity to take over a brigade staff position. And back then, it was called a musculoskeletal action team leader. It was me, it was a PT tech at times, and then we had a couple athletic trainers and strength coaches. So my job was just that. It was to get ahead of the injury, and first and foremost, you got to know what the problem is before you can address it, right? And as a provider, that introduces a challenge, because not only am I a provider now, I've got to be a data analyst, more or less. So coming up with creative ways to collect that data, analyze it, and then take that to leadership to, one, make them aware, but also come up with courses of action to try to get at solving the problem. And I think, on a whole, that's what we're trying to do in the Army. Here we have, here at Fort Jackson, we've got a pretty robust program. We've got a troop medical clinic where all the trainees will be seen, but first they're looked at by the athletic trainers who are nested within the units. And we also have physical therapists at the brigade level there as well. So they'll get seen by those athletic trainers, and they'll do the best they can to manage them, keep them in training. But based on some criteria we have, as well as communication along the way, if need be, we end up seeing them at our troop medical clinic, and those are the guys that we're more than likely going to have to take out of training. And then we have what we call a warrior training and rehabilitation program, where we'll kind of pull them out of training, provide them an environment for healing, recovery. And again, there are some limitations on how long they can stay within that program, but depending on the injury, most guys will give every opportunity to succeed and get back into the fight. Again, some injuries, obviously we're not going to prevent all of them, but I think with the setup we have, and it continues to grow, become a more robust program. Speaking of H2F and IET here, I think we're making ground. And here we're actually, we've kind of taken it upon ourselves to have a symposium here in the upcoming weeks to try to bring together smart people, people who are passionate about taking care of folks, particularly bone stress injuries, which obviously we have a unique issue with here. Bringing these guys together to ensure we all understand where we're at right now, what challenges we face, and then just walk away with goals. So I think sometimes we can kind of get lost in the everyday whirlwind, and this is an opportunity we're taking to make sure that that hasn't happened and that it won't happen, and then just continuing that momentum.
So my next question is, people want to know about a success story from a point of injury, from the soldier coming to you. Maybe they've had a surgery or something, to recovery. What is probably something that's most highlighted in your career, or something that you remember most, or touched by the most?
Sure. Sure, I've had several that have come and gone throughout my career. As a physical therapist, I think the most rewarding opportunity I've had was with my last unit, with 1st Special Forces Group. So spent about 45 days deployed with those guys. Had the opportunity to take care of a lot of guys on the spot there that had pretty significant injuries, but kind of a different breed of individual there when it comes to determination and willingness to work through, let's say, inconveniences that would probably be more than that to us, I'd say normal folks. But I was really inspired by, the degree of discomfort that these individuals would endure. And again, my job in that environment really is just to keep them in the environment. Obviously, you're not going to solve any issues out there. You're really not going to rehabilitate anyone. You're just managing folks and keeping them in the fight. And to drop into a location, one day, and sometimes I'm treating them right away as soon as I get off the chopper, and then sometimes I'm waiting on them to come in from whatever the mission was that day to take care of whatever might be coming in. But to take care of those guys and then also watch them go out that night, the guys that you're working on, to defend our freedom, I think that was by far the most rewarding. And again, had multiple opportunities out there serving those guys in 10, 12 different places where just drop in, get the job done, and move out. Very rewarding, and definitely appreciate that opportunity.
Okay. Somebody wants to know, were you able to do a residency after doctorate of physical therapy at Baylor?
Sure. So, got my doctorate, entry-level physical therapy doctorate in 2011. And again, that's when I went to Fort Benning. That's where I mentioned I did the staff job and ended up as a brigade, what we called a MAT leader back then. And in my mind, that talked about kind of paving the way. How do you kind of pave your way to, the goal, your target? So took that job, knew it was coming open. So, you have to network and kind of pave your path. But 2015, I'd already served in that position a couple of years, and the opportunity to apply for a sports medicine fellowship came about. And there are some challenges in the Army when it comes to administrative side of the house. How long you're on station? Some guys are really cut out for the programs, and for example, they may be on station only for a year when you have to serve 2 or 3 years on station when this opportunity comes up. But for me, the stars aligned, and applied for the program, was accepted, was able to go to West Point, and it was a doctorate program, science physical therapy. 2 is a sports medicine fellowship, and 3, and maybe most importantly, I got to know a lot of people who were passionate about a lot of things I was passionate about. A lot of people doing a lot of good research, and those networks that I was able to kind of form there have definitely helped me out and helped the organizations out that I've gone to thereafter. So did. Obviously, it wasn't, all I had to do was pay back time, 1.5 years in the program, 3 years to pay back. I'd already paid back my obligation related to my entry-level doctorate, and now I've gotten that obligation time behind me as well.
The last question is, what made you choose the Army Baylor program over any other doctorate of physical therapy program? Why did you choose the Baylor program?
Yeah, sure. So that's a pretty easy one. As I was getting out on the enlisted side, again, I'd served 4 years. I signed up for 3 years, got stop loss, so I had to stay in a little bit longer than I expected. But on the back end of that, I had the opportunity, that's when they're going to offer you bonuses. That's when they're going to offer you jobs. So they were offering me, to transition over to a physical therapy technician and money along with that, which would have been great if I was just coming in the Army, because that's kind of what I wanted to do. But again, that wasn't an offering at that point in time, because you had to serve before you could take that ASI or additional identifier as a PT Tech back then. So got out, didn't take that opportunity, got out, and I had already done a couple years of junior college, so I had that time behind me. And I had about a year and a half, if the timing was going to serve me right, to get my all the credits I needed. And by this time, there were going to be credits falling off because, at least at that time, I had about 7 years before I'd start losing some of the credits I had initially earned during my previous academic time frame. So Army Baylor honestly was the most flexible compared to a lot of the other programs that I looked at. And honestly, it was at a year and a half out, so 08, I had gotten out in 06. It was the only program that I could really apply to. I was looking at St. Augustine and other programs. Obviously, I would have probably had to pay for that unless I'd gotten into the military after the program. So Army Baylor was really the only one. And then, not to mention that once you get selected, you're direct commissioned. You're getting paid as an LT as you start school. And of course, the school is, it's paid for in time, which isn't a problem. I already had time in service and the enlisted side, and just tacking on more time in addition to the school that I was given. So it was, I felt very, very blessed. Felt like I was going to have to give up my firstborn or something along those lines. But it was, yeah.
Okay. And Major Nick, so thank you. We're going to move to the last 2 questions with Major Newmeyer, and then I have something for you guys. So almost done with your time, but Major Newmeyer, can you hear me?
Yes, I can.
Perfect. So I know we kind of cut you off. I apologize. I wanted to finish up your last question. Well, 2 questions. How did your family feel about you applying for the HPSP program?
Yeah, so I think we got cut off as I started answering. So initially they were pretty shocked because when I went to all my family and close friends knew that I wanted to go to med school, and that was the plan. No one really envisioned, including myself, the Army being an avenue to do that. But once I explained the benefits that it offered financially, the stability, or even post-residency, the great quality of residency training, everyone was really excited about the opportunity. So there was a little bit of an initial shock, but then everyone warmed up once they learned more about it.
Okay. And we also asked Colonel Thorpe this question, but we have you as a female on here as well, so I'd ask the same to you. How do you feel it has been for you serving as a female in the Army? Or what would you have to say about that?
Yeah, so I get asked that question a lot, and I'm trying to think of a great answer, because for me, as a woman in the Army, I really feel no different. Like, I'm able to do my job. I have the same opportunities. It's a super cool time to be a woman in the Army right now. They're making a ton of changes to make it more family friendly. And so in my experience, I have not had any prejudice or anything against me, and I've loved my experience. And I think we got to this a little bit earlier, talking about family life or being a mom in the Army. I think being a physician mom, whether you're in the Army or as a civilian, is hard. And there's not real such thing as balance. It's just priorities week to week. So those weeks I was describing where I'm on call, my husband takes a lot more for our kids on, and I get to see them a little bit less. But then the following week, when I'm on more of my admin time, I get to pick them up and drop them off at school, so I get more time with them. And so it's just a shifting of priorities week to week. That's hard whether you're in the Army or not.
That's really nice. Okay. Well, I want to say thank you all for your participation in today's panel. But before we go, I do have something for you. Can you manage this real quick? So time out of your busy schedule to come and assist us. We have a few things for you. And I'll put it on here so Major Newmeyer, yours will be coming in the mail. So I'll get with you after to get a good address so we make sure we send yours to the mail, okay? So we have Major Houghton, Colonel Thorpe, Colonel Stewart,
Thank you.
and Colonel Bosley.
Hey, thank you.
I know that you guys are very, very busy. We've taken a lot of time from you all. So just to take the time that you guys did take and come and do the interviews with us, sit here patiently while we work through this technical difficulties. I'm just very, very thankful. This is not something that we have done very long. I think this is our second one that we have done, and this is better than last year's. We have equipment now that you guys sound amazing. I have gotten a little bit wiser with the editing, still a lot more to go, but we're just trying to share the information out to the students. We're trying to let them know what the Army is about. So many people are interested in going to other branches because they know nothing about what the Army has to offer. So this is just one step. We do have intentions of taking it a lot farther. I'd like to start a podcast, but we'll see. But yes, and thank you to my team that has been very supportive and making this happen as well. I'll take care of y'all another way at the station somehow. But yes, thank you all for your time. And thanks, Facebook, for participating with us. I hope that we have been very informative for your decisions in the near future. Thank you.
Thanks.
Thank you.